Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. As COVID-19 continues to pose serious health challenge around the world, National Orientation Agency in Imo State take awareness to the streets, ask citizens to take responsibility. Nigeria's COVID-19 response gets a boost with the Association of Nigerian Physicians in the Americas donating personal protective equipment worth 30 million naira. And Brazil's President Jair Bolsonaro tests positive for COVID-19, his fourth time taking the test after developing symptoms including a high temperature. The Nigeria Center for Disease Control, NCDC, officially confirmed Cross River State as one of the list of states in the country with confirmed cases of COVID-19, as the center announced 5 infections in the state yesterday. According to the center, 3 patients have since recovered in the state, 1 death recorded and 1 case is active. In 24 hours, 9 deaths were recorded in Nigeria, 3 in Edo, 2 in Plateau, 1 each in Enugu, Jigawa, Gombe and Cross River State, putting the death toll at 654. While 575 new cases were recorded in 19 states and the Federal Capital Territory, bringing the total confirmed cases to 29,286, while 11,828 patients have recovered. A regional breakdown shows Lagos, the FCT, Kano leading in the southwest, the north central and the northwest respectively. Edo State leads in the south-south with 1,435 cases, while Borno tops in the northeast with 547 cases, and you have Ebonyi leading in the southeast with 503 cases. Over in Delta State, the Commissioner for Information, Mr. Charles Anyago, and 21 other persons have now recovered from COVID-19 after testing negative to the virus. Mr. Lisaife Jika, the Chief Press Secretary to the Governor, said they were discharged after long periods of isolation and treatment from various treatment centers across the state. He also adds that the Secretary to the State Government, Mr. Chiedu Ebie, who tested positive the same day as the Commissioner for Information, is awaiting the result of his final test to determine when he would be discharged. It will be recalled that government officials tested positive to the virus June the 20th. Ms. Ifejika reiterated the appeal of the state government to the people to support its efforts at curbing the spread of the pandemic by complying to the safety protocols prescribed by the NCDC. Now, ahead of the resumption of domestic flights in Lagos and Abuja airports from tomorrow, July the 8th, after air travel was suspended due to the coronavirus pandemic, airline officials are rearranging, rejigging their systems in line with the new protocols for the aviation sector to enhance passenger facilitation. A visit to the General Aviation Terminal in Lagos showed last-minute efforts by different parties in preparation. The process of disinfecting the aircraft was also seen with reassurances that the chemicals are not harmful to humans.
It is not injurious to passengers. The person that will do the disinfection will go in first, disinfect the whole aircraft, and that person will come out. Thereafter, our cleaners will go in and do their cleaning activities. And after they finish with this cleaning of the thing, the person that is doing this disinfection will go in again for the second time and disinfect the aircraft, thereby leaving the aircraft for the next 1 hour before we start boarding passengers.
Meanwhile, for interstate road travelers, the Federal Road Safety Corps, FRSC, says it will start enforcing the use of face masks, spacing in vehicles and physical distancing as the restrictions on interstate travel is lifted. The FRSC Corps Marshal, Mr. Boboyo Yemi, stated this at a meeting with road transport unions and operators in Abuja, where he listed guidelines for road transporters.
It is most pertinent to reiterate the blazing truth that the ravaging coronavirus is a highly contagious disease that spreads through human interactions. As such, As such, resumption of mass transit operations without putting in place all the necessary precautionary health and safety measures will be in itself a springboard for the speedy escalation of the spread of the deadly virus. To this very end, it is instructive to categorically state that all transport unions, from NURTW to NATO, RTN, NUPEN, PTD, Akomoron, and Pitona, and others must brace up with the present reality and ensure strict compliance with the following: disinfecting of terminals and luggage of passengers, minimizing contact with paper money and adopting electronic ticketing system. The implication of these guidelines is that the capacity of passengers to be conveyed by commercial buses is now reduced to 50%, while saloon car will carry only one passenger in front and two passengers at the back. The Corps has also deployed its officers and men to ensure strict compliance with the outlined guidelines, both on the highways and in terminals. As such, we have resolved to leave no stone unturned in ensuring the safety of all road users as they migrate from one point to the other.
And in the face of the COVID-19 pandemic, the government of Ekiti State is looking ahead, and agriculture is one of the areas in focus. Our correspondent Babajide Agbeya brings us up to speed as to how the government plans to stay afloat this period.
Ekiti State has been trying to pay attention to agriculture as part of efforts to mitigate the effects of COVID-19, which may be reflecting in form of food crisis. The state says it's committing about 2 billion naira to creating access to land for farmers, and other agricultural support programs are also expected from the private sector in partnership with the state.
One of the major problems of agriculture in Ekiti is accessibility of land. Not that lands are not available, we have lands, but that the lands are accessible. But in the provision of 2 billion naira to do land clearing, you know what it means. That means land will be more accessible to our farmers, because a lot of requests that we got from farmers in terms of people who wanted to go into land and to agricultural production is in the area of land. And I believe land is one of the things that we can provide for our people. So the moment the issue of land is taken care of, the other thing we can, these are things that private sectors can really come into. And this is what we are trying to do. And by doing this, we believe we will, because our major program for the year is to have food security for our people, because we know what this pandemic means to our people. Look at what has happened by CBN. It is not CBN that bought out this one. They brought in private sector to supply input. And as I speak with you, most of those who are going to Anchor Brewers program, basically inputs are no longer an issue with them, because one of the things they need to do is they have to arrange to get that they have input supplied by the private sector.
It is definitely time for stakeholders to think ahead as the pandemic takes its toll on the economy. Babajide Agbeya for COVID-19 update.
In efforts to reduce infections among frontline health workers is getting a boost as the Association of Nigerian Physicians in the Americas, ANPA, donates personal protective equipment worth about 30 million naira to the Nigeria Center for Disease Control, NCDC. Speaking at a brief handover ceremony of the items in Abuja, the representative, Mr. Benjamin Nayamu, says the association hopes that the donations will help frontline health workers to be safe while caring for those with COVID-19.
The outbreak of COVID-19 in Nigeria about 5 months ago has no doubt exposed many frontline health workers to the dangers of being infected with the virus. According to the Nigeria Association of Resident Doctors, over 800 health workers have tested positive for COVID-19. 29 out of this figure are staff of the Nigeria Center for Disease Control, NCDC. At the headquarters of the NCDC in Abuja, the nation's capital, efforts to protect these health workers got a boost as the Association of Nigerian Physicians in the Americas donated personal protective equipment to the NCDC.
As a physician myself and my colleagues in the United States, we understand why it's important to keep our physicians and nurses and other allied healthcare workers safe while we pursue this, what I would describe as war, and execute a plan to ensure that our people are safe and that we win this pandemic ultimately.
The items donated include 3,000 pieces of hand gloves, 1,000 pieces of N95 face masks, 2,500 pieces of KN95 face masks, 3,600 disposable water-resistant long-sleeve gowns, among other things.
This is just one example of the great support that we've received, and we're extremely grateful to our colleagues in the United States and in other countries in the America that have come together to rise to the challenge and support the work that we're doing. This really demonstrates not only the love and affection that they have for our country, but their professional commitment to the work that we're doing. So we all have to come together and find ways to support everyone playing a role in this response so that Nigeria can get back to its greatness that we've always had.
We over there in the United States have looked at what is going on in Nigeria, and what you see here is through personal donations from individual members of AMPA, Association of Nigerian Physicians in America, who were motivated to commit their own money, put it together under the leadership of our president, Dr. Shaman Emelife. People put in their dollars and cents together, and then we're able to purchase these items.
The Nigeria Center for Disease Control is the lead agency of government that is responding to the COVID-19 pandemic, as well as other infectious diseases in the country. These donations, no doubt, could not have come at a better time than now, when several health workers, including staff of the NCDC, are testing positive for the virus.
In today's briefing by the World Health Organization, the body is still trying to find out where the coronavirus came from, because understanding it can take us a step closer to fixing the problem. According to Dr. Michael Ryan, an executive director with the body, if the walls of the castle is breached, we need to know where the breach is so we can fix and repair that breach. We have Professor Miriam Aminu. She's a professor of virology at Madu Bello University, Zaria, and she joins us from Zaria via Skype. We'd like to thank you for joining us on the program. I'd like to ask what we're hearing from WHO on the virus, and then what we heard from the Oxford scientists who said that the virus may not have originally come from China, but might have been lying dormant across the world until emerging under favorable environmental condition. What's your take on that?
For having me, the virus originated from animals. There is a study that was published in Journal of Advanced Research and Nature. It came in July 2020, and the virus has been found to be phylogenetically related to SARS virus in bats. The viruses belong to SARS. COVID-19 belongs to coronaviruses, and coronaviruses have been known to be existing for a long time. And then these viruses circulate in animals, and they have been in existence for a long time. So I have no doubt that this virus originated from Wuhan, perhaps from animals, perhaps from the bats. So I do not agree to what he is postulating.
I'd like to finally get your thought on the way we're tracking the virus, especially the spread in Nigeria. We're seeing all states that have recorded cases now. What further advice would you give to the presidential task force to containing this and ensuring that we reduce our numbers, we flatten the curve?
Well, now that the virus is we're in the community transmission phase of the virus, tracing cases and testing vigorous tests may not be the priority now. What we should do is to identify the characteristics of the virus and the severe cases, identify and treat, and step up the laboratories so that they can prepare for the surge in cases. In addition, the non-treatment, that's non-pharmaceutical way of treating the virus, of taking care of the virus, such as observing distancing, social distancing, avoiding large gathering, we go a long way to curbing the virus. The most important thing is that we must vigorously test and test and test so that we can find out those that are harboring the virus, those that are asymptomatic, and then we can treat them and isolate them.
All right, we appreciate your time, Professor Miriam Aminu, Professor of Virology at Ahmadu Bello University, Zaria. Thank you for joining us on the program. We have more on the COVID-19 updates when we return. Stay with us. Live to the streets. Here's our correspondent, Eito Kwekuteye, with more.
Since Nigeria recorded its first case of the coronavirus disease between February and July, the country has recorded over 29,000 confirmed cases of the coronavirus with over 600 deaths. Down here in Imo State, so far, the state has recorded over 350 cases with 3 deaths. Even with the records and the level of awareness on COVID-19, to some people, COVID-19 is still a shell game. Earlier today, we moved around Owerri, the Imo State capital, to speak to indigents to assess their level of awareness and knowledge of COVID-19.
The sickness just came from all the way from China and ravaged the entire country, the entire countries, including Nigeria. And they say if somebody contracts it, you fall sick, you will die almost in 2 weeks. That's the only thing I know about it.
We have to be using our mask, and I have my own. And if you don't have any important thing to go, you have to stay at home in order to avoid contacting it.
The National Orientation Agency in Imo State sheds more light on the strategies and measures put in place to sensitize the public on the COVID-19 virus.
I am aware that in almost all the LGAs, my COMOs, that's the Chief Orientation and Mobilization Officers, have led the sensitization committee in the LGAs to all the communities, paying advocacy visits to the traditional rulers, to the religious leaders, carrying out motorized campaign with their megaphone. Sometimes they do what I may call edu entertainment. As you're going, some children will be following you and you'll be telling them the rules and regulations.
The protocols and guidelines put in place by the state government to contain the spread of the virus is still very much intact, as indigents are advised to comply with all these protocols and guidelines. From Owerri, the Imo State capital, Eito Kwekuteye for COVID-19 updates.
Joining us in our Lagos studio is a cognitive psychologist, Mr. Tosi Imogeme. We'd like to thank you for joining us on the program.
Yeah, it's my pleasure.
Now, in Asia, when the pandemic really started, we watched, we saw, we read how they talked about discipline in their activities and some of the preventive measures that they took. Even though some people even called that autocratic, the way the government, cut down on a lot of things, locked down a lot of things, and the aggressive testing that they also put, together. But do we have what it takes in Nigeria, looking at the fact that we're still seeing an increase in cases daily?
Yes, of course, I believe we strongly have what it takes in Nigeria. You see, even since the beginning of time, or since man has been created, it's been very difficult. Man has always fancied his freedom. So the moment you say, do not do this, that particular thing you're saying the man should not do becomes a big deal. And then it becomes difficult to refrain from doing it. That's psychologically. So what you do, you need to enforce laws that will curtail behavior. That's what even happened, during the time God had to say, okay, thou shalt not eat the forbidden fruit. If you do it, there will be a punishment. So without punishment, without enforcing human behavior, it becomes difficult to manage human beings. Because the truth is, as opposed to machines where you just create codes and they, follow instructions, human beings, you need to be on their neck. You need to always enforce the laws for them to comply. So I think, beyond a reasonable doubt that, yes, we have what it takes. All we need is for our law enforcement agencies to be much more disciplined, to take absolute responsibility. I've seen cases where, in the bus, you see people who are not supposed to sit. We're supposed to have about 3 people on seats, and then maybe during the night when they're going home, you see they have 4, they have 5. Some people even lap themselves and all that. So that's where we need our law enforcement agency to curtail the behavior. We have what it takes.
So in terms of the new normal, the NCDC identified one challenge to the communications campaign. It said there were decades of mistrust in the Nigerian government. Looking at the efforts of the Presidential Task Force on COVID-19, do you think that that is still a challenge to this fight?
Yes, it's a major challenge, because the truth is, it's just like you being in a marriage. If there's no trust, it cannot be a smooth relationship between husband and wife. So if your husband tells you that do not do this or do not do that, whatever he or she tells you, it becomes difficult to believe. And, leadership has always been our major challenge in Nigeria. People do not really believe the kind of leaders that we have, and we see our leaders as those who we see them as self-centered. So I think despite the effort the PTF are putting in to ensure that things, are well, we adhere to the rules and regulations, Nigerians will always feel that, no, why should I trust the government that does not care about me? Now, we heard about relief funds being disbursed, and a lot of people didn't get it. In my own CDA, I heard that they, brought about 5 palliatives, and we have over 150 people. A lot of people, so you need to take this into consideration. And then we've had relief funds here and there being misappropriated. And these are things that the people are, hearing. So it's easy for the leaders to say, oh, adhere to rules, because yes, they're well fed up, they can't, take good care of themselves. But for the average man on the street, that this poverty is on the increase, and unemployment is also, increasing. The real pandemic here is no longer coronavirus. The real pandemic here is poverty. So I would rather, as a human being, psychologically, I'd rather go out there and look for food for my child than watch my child die out of hunger. If I cannot control, if coronavirus is something I cannot control, it's understandable that you're helpless about the situation. But that which you can't control, which is providing basic amenities, providing food and, the necessary things for your family, if you cannot provide it, who would, as a man or as a parent, you would not forgive yourself if your child should die?
All right. I'd like to thank you, cognitive psychologist Tosi Mogeme. Thank you for your thoughts on this issue. Brazil's President Jair Bolsonaro has tested positive for coronavirus. He took the test, his 4th, after developing symptoms, including a high temperature. He has repeatedly played down the risk posed by the virus, calling it a little flu and saying that he would not be seriously affected by it. He has also urged regional governors to ease lockdowns, which he says hurt the economy. And on Monday, he watered down regulations on wearing the face mask. Here's more on our global update.
Australia's second largest city, Melbourne, is back on lockdown as the border between New South Wales and Victoria has closed for the first time in more than a century. People caught crossing the border without permission through any of the 55 roads or several river and wilderness crossings will face penalties, including a fine of 11,000 Australian dollars and 6 months imprisonment. In the United States, law enforcement officials in Texas say they will not enforce the newly enacted ruling that requires masks to be worn in public. The order also specifically says no citizen can be arrested or jailed for refusing to wear a mask. After the Texas governor ordered masks to be worn in public in any county with at least 20 COVID-19 cases on July the 2nd, multiple county sheriffs vowed not to enforce the rule. And just after the Super Saturday reopening of bars and pubs in the UK, 3 have said they have shut their doors again after customers tested positive for COVID-19. Ministers have faced criticism that the country is unlocking far too quickly relative to its rate of infection, predicting a second spike of positive cases as restrictions ease. In Pakistan, Prime Minister Imran Khan handed over the first batch of a dozen locally manufactured ventilators to the country's National Disaster Management Authority in the northwestern city of Haripur. Virus infections surged after Khan lifted a countrywide lockdown in May. But lockdowns have been reimposed in certain areas since then in what the country calls a smart lockdown. There have been 231,818 coronavirus cases and 4,762 deaths in the country.
From the NCDC, it continues to work closely with states. You can find the latest national strategy to scale up access to COVID-19 testing in Nigeria and other public health advisory on the disease. You can access emergency contacts as well if you need to. The live feed of the World Health Organization's website also has regular updates about the spread of the pandemic, strategies guiding the public health response at both national and subnational levels. Of course, our website, channeltv.com, is live with the latest update. News you can see there, our head story there, talking about politics and several other stories from Nigeria, Africa, and across the world. That's a COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe.